Hello, everyone, and welcome to an edition of Virtual Project Table Talk. I'm Maria Turner, the Executive Director for the Fond du Lac Area Women's Fund, and I'm joined today by co-facilitator Erin Flood, a member of our Board of Directors, as well as several guests today. First, we have Karen Monfrey, the President of the Women's Fund of Greater Green Bay Board of Directors, Julie Keller, who is the Executive Director for the Women's Fund for the Fox Valley region, and Karen Schneider, a board member with the Oshkosh Area Women's Fund. The reason we're all gathering here today, the Women's Funds representing Northeastern Wisconsin, is we want to share with all of you some of the results of a really sweeping study we did regarding COVID-19's impact on women in Northeastern Wisconsin. So just to give you a little bit of background on what this entailed. So the 4 women's funds in Northeastern Wisconsin, from Green Bay down to Fond du Lac, got together last fall, and we were talking about how COVID has disproportionately impacted women. We had a hunch, we were hearing the national stories related to that, but we wanted to have some local statistics to back up some of what was being said nationally. So we embarked together in establishing a funding resource through the Greater Green Bay Community Foundation Basic Needs Giving Partnership, as well as the Point study through US Venture, to allow us to hire the Research Institute team from St. Norbert College to help us create a survey that would empirically show what we were seeking to find out. So we then conducted the survey from March 16th through April 27th of this year. We had 1,050 respondents, and the median age was 45 to 54 years old. We had a representation from each of the counties: Outagamie County 26%, Winnebago 25%, Brown 22%, and Fond du Lac 15%. 82% of our respondents were employed, and at least half of them had a bachelor's degree. The median income, household income, was over $75,000. So that's just to give you a little bit of the background. Now we're going to get into the bones of exactly what the survey brought forth. So I wanted to start with one of the more shocking findings I think all of us found when we looked at the survey results related to women's mental health and stress. Could you share with us what the survey covered, Karen, related to the pandemic's effect on women's mental health, their ability to receive counseling, and some of the things that were uncovered related to prescription drug use during this time?
Sure, yeah, I'd be happy to do that. And as you laid out, Maria, this is really the women in the middle, the working women that we had a lot of income ranges from very high to very low. We had a lot of age ranges from elderly, no kids, to very young, no kids, and everything in between. The median, though, the bulk of the survey participants were what I call the women in the middle, the working women. And not surprising, most of the child care responsibilities fell to mom. And that, is particularly true for partnered couples. So unpartnered women who were without a partner, relied more on family and others to help care for the children. But the partnered women, most of them, almost 70%, really cared for the child versus someone else in the family unit. And not a surprise, when we take away the support systems for women, the child care and the schools, all of the support systems that enable mom to be able to focus and spend time on work, mental health suffered. So that part was not as surprising, because more than 75% of the women respondents reported having moderate to severe impact on their stress levels, their mental health levels. And that was consistent with what we saw in some of the national surveys. The shocking part to me was that really about an equal number received mental health care, about 23, I think it was, percent received mental health care support, but 19% did not wanted to receive care, but did not receive care for mental health. And that's shocking when you think that's about 1 out of 5 women that wanted help couldn't get it. So not only were the support systems surrounding schools and childcare, but the support systems around just areas that they could let off some of that steam in that mental health. So severe impact. And the thing about mental health is it's not going to go away overnight. When you have these issues, they take time. And when you have, severe trauma, it takes time to recover. And that's what the survey showed, that most of the women felt it's going to take some time before things get back, if you will, quote unquote, to normal. Another really, really shocking thing for me is about a third, 1 out of 3 women took prescription drugs to be able to focus, concentrate, sleep, whatever, prescription medication, about a third. And when you think about that, that's really shocking. And again, all the support systems were gone, right? So we turned toward pharmaceuticals, which is really a sad answer if we don't have other more constructive support systems available.
Yeah, thanks, Karen. Just to kind of look at another layer of this, as a working mother, I always struggle to find some balance between work life and home life. And this, I felt actually very fortunate that at this point of my life, I was a stay-at-home mom during the pandemic. But I watched my sisters be full-time working moms with kids homeschooling, and the layers of complication that added just to life and stress. Can you tell us, Julie, just a little bit about what the survey revealed related to working moms with school-age kids?
Sure, happy to. Perhaps one of the most dramatic impacts of this pandemic was the combination of that remote work, or not even being able to do remote work, and then the sudden loss of your childcare. Your kids aren't in school, they're trying to do homeschooling. Families are trying to figure all of that out. So the survey results showed that more than any other family member, it was the moms, overwhelmingly the moms, who reported that they were responsible for the coordination of the childcare and also for supporting their kids through homeschooling or online schooling while working. So we saw that 41% of the women surveyed did have children in their home that were enrolled in a private or a public school during the 2020-21 school year. And of those women, 2/3 said that they were the ones primarily responsible for their children and their at-home schooling or online schooling. So that really alludes to a lot of what Karen said about the mental health, because that's time that women that's their work time, and they're trying to balance either taking care of kids or helping younger children with online schooling. And so that challenges and the time constraints where, you feel like you're trying to do it all, and you don't feel like you're successful at any of it. And I think that really points then to the mental health issues that we saw also in the survey. So yeah, overwhelmingly it was moms who were the ones primarily responsible in their household for trying to figure out childcare as well as schooling.
Yeah, thanks, Julie. I also thought about what this would have been like if I had kids that were younger than school age that really needed childcare. Karen, can you tell us a little bit about the survey results as far as what women were dealing with who had kids who weren't school age and what childcare looked like? And then I understand that the Oshkosh Women's Fund is already doing some work to address the deficit for working women. So can you share with us that effort as well, please?
So, one of the things I think we're finding is that these all are so intertwined, but with childcare, I think we broke the perception that it was lower household incomes that had the issue. Because as Karen said earlier, and Maria as well, about our average household income, but 60% of those moms had children under 18 that they're the primary caregiver. 77% had a decrease in earnings. So when you're decreasing your earnings and you're responsible for that childcare as well, you're going to have that impact there. And 1 out of 4 saw a decrease in their employment due to the lack of childcare. Part of that as well is a lot of childcare providers at the time had to reduce their numbers, and a lot of them would only accept those who were essential workers. So a lot of those middle moms in those mid-range ones would be having trouble finding the childcare for their children, whether it was school age or younger. So, there's the Child Care Resource Center, and the Women's Fund is looking at partnering with them, I believe, in order to increase the amount of childcare providers that are available. But it is one of those aspects that we kind of forget about until it's needed. And in reality, everybody needs that childcare assistance and that support system to help them along.
Mm-hmm. Yeah, I don't think I was ever more grateful to have teenagers and older than I was during the pandemic, right? I mean, normally you're being a mom of a teenager, that is not usually all that fun, but my daughter was very self-sufficient in terms of being able to get on the computer and online school, and that helped ease, the burden on me. But I looked around at so many of the women I know, and they were just super women, they were doing so much. And so I can definitely see where that would have been a stressor for those moms with really young kids, and any children that were being homeschooled in their homes as well. So Julie, you and I have both worked in the domestic violence field, you at Christine Ann in Oshkosh and me at Harbor House in Appleton, right around the same time, actually, several years ago. And so for me, when I was hearing the stories about the potential for domestic violence and child abuse to increase because of the isolation during COVID-19, I was really interested in finding out, what that looked like locally, and whether there truly was an increase in the prevalence of domestic violence and child abuse overall in all households, or if it matched what many advocates in the domestic violence and child abuse areas will tell you, is that stress does not create violence in homes if the individual is not already someone that would have a propensity toward that. And so I think the findings were really interesting in that realm. And for us in Fond du Lac, with our Fond du Lac Says No More initiative, the Women's Fund partners with several agencies here. This is really great information to have. So can you speak to that a little bit, Julie, and your perceptions of those findings as well?
Yeah, absolutely. So, we all remember the safer at home order, and we were, told it was safer to be at home, which for a lot of us, that was absolutely the case and absolutely what we wanted to do and needed to do. But for a lot of people, safer at home does not mean they are safe in their homes. And really the data from this survey did confirm that. So the results indicated that there was an increase in abuse of women and children, where abuse was already prevalent in the home. So what you referred to as Maria, that it was already there before the pandemic, but that abuse did increase during the pandemic. So for instance, before the pandemic, 24% of women disclosed that their partners sometimes, usually, or always argued with them or yelled at them. And this increased to 38% during the pandemic. For criticizing the way they do things, the number rose from 23% before the pandemic to 41% during the pandemic. So you can definitely see some trends there that that abuse got more prevalent and more intense during the pandemic. And then we also saw similar trends for children. Before the pandemic, 15% of women disclosed that their children being argued with or yelled at, and that increased to 25% during the pandemic. and criticizing the way their children did things rose from 15% to 23% during the pandemic. So this really highlights the challenges that women face and children face when their traditional support systems are cut off, their access to maybe shelters or other safe places they could go. We know from our experience of domestic violence that some women go to the mall to get away when things start to escalate, and even that was not available. You did not have those places where you could get away from the abuse or the tension in your household. So we definitely saw that, those results in the survey as well.
Thanks, Julie. All of what we've talked about so far has been, although extremely informative, pretty heavy. And I just want to highlight too that this survey also brought about some things that are positive, or things that we can, although all the information that we've talked about and shared can certainly be used to inform programs moving forward to better support women and children. We also found out some things that were positive. So Karen, can you just tell us a little bit about the positive things that we learned from the survey? Oh, Karen, you're muted. Hang on. Come back to us. There we go.
Sorry about that.
Oh, it's okay.
My dog was barking in the background, so I thought I better mute.
No.
So yeah, we focused on the areas that we've touched on, mental health, childcare, and work and work-life balance and things like that. We also asked a number of questions regarding ability to pay rent and mortgage, more of the financial stress, and the prevalence again of those women in the middle really did not have concern that their mortgage or their rent payment would be made, which really goes, I think, to the support, that financial support that people were able to get. The lower income, not a surprise, again, the lower income women were able to get support and receive support, and there we saw a lot more stress, and that again is aligned with national surveys for many of the women in Northeastern Wisconsin, that middle income women. They were not concerned about the ability that they were going to lose their home, or they were going to be evicted, and I think that was a real positive that came out of this. That was probably the most positive thing. The other thing that I think is a little interesting is about more than 60% of the women saw no change to their work. They worked about the same. About 20-some% worked more, 20-some% worked less, and about 60, round numbers, were worked about the same. So that also tells me we found a way, and women are resilient. We need our support systems. I think that's the big takeaway from me. It takes a village to raise a child. That's an old saying I've always loved, and I love it even more now. But women found a way, and 60% really were able to maintain. I think that's remarkable.
Maria, I know it's your turn to talk, but I just want to say, Karen, I love that you brought that up, because during this whole discussion, I just keep thinking that it really comes back to how much we need each other. And I think it's important to
Absolutely.
Not only do we know that from our own experiences, and did this absolutely highlight it for us? Yes, but the research also confirms all of that to be very true. So thanks.
Yeah, I would agree with that. I think another positive is we all probably can take some personal learning away from all of this. I personally was well more affected by the isolation and not being able to interact with colleagues face to face. Zoom just wasn't cutting it for me. And I'm an extrovert by nature. And so I was feeling like I was trudging through mud at times, and so, but now that I really know that about myself, I don't know that I truly recognized how important that was to me prior to the pandemic. So that was huge for me. There's personal learnings. And, there's also things that we as women's funds now can look at this data and strategize individually with our boards and our community partners, but also, collaboratively, like we've been talking, the 4 agencies, to do some positive things. Certainly inequities in workplaces for women existed prior to the pandemic. There was not equal pay prior to the pandemic. Those things are still things that need to be worked through for women. But I think in terms of the flexibility to potentially work from home now, that has actually increased or could potentially be an ongoing thing for women. And I think that's potentially a positive. And then I also think, just taking some of this information we learned about combating violence against women and children, which is work that we've all done in some way, whether that's partnering with shelters or other community partners, or, programs that we do individually ourselves, those learnings should take us in a direction of, potential systemic changes and things like that. Karen, can you talk briefly to us and give us an overview of some of the things that we've discussed as potential next steps as the 4 women's funds in the Northeastern Wisconsin region?
Sure, absolutely. I think we all knew that caregivers needed respite before, but I think COVID brought that out even more so, that we need to address their stress and the challenges they face. The childcare system, you mentioned, high cost of childcare, low wages. We have to do something to help that as well. And having, low wages for highly educated workers just doesn't make sense. And then increasing the access for childcare. We have to be able to have resources and support for domestic violence victims out there, so that they know where they can go and get that. And, one of the big things is, you're talking about flexibility, is working, especially with workforce shortage, right? So being able to work with employers to provide those supports that will make the women successful at work and meet those home obligations. The women in the middle, being able to do that, it'll benefit women, families, and their employers and their businesses. So we do have our work cut out for us, but I think we're in a really good place to make strides on those.
Mm-hmm. Yeah, and I don't want us to come across in, our focus in talking about women in the middle. I think we all recognize that even though our survey may not have captured what happened to women of color and women in low income families, we know that if there was an impact on women in the middle, then there certainly was a greater impact on those populations as well. So I think, that's a learning that all of us also took away, and we'll all work to, bring more equity to those groups as well. So as far as if any of this has sparked curiosity for any of you listening today, we encourage you to take a look at the full reports. You can log on to any of the websites for any of the women's funds. So again, it's the Women's Fund of the Greater Green Bay area, Women's Fund for the Fox Valley region, and the Oshkosh Area Women's Fund, as well as the Fond du Lac Area Women's Fund. We all have links on our websites that provide a PDF of the full report. You can take a look. We encourage nonprofits in particular to take a look, because I think we all are looking at this, providing some insights into our personal grant making as we head into our seasons, doing that as well. And then also there is an interactive dashboard that allows you to drill down by county. Again, that link is on any of the Women's Funds websites, and available to anyone who's interested in taking a peek at that information. Does anybody have any last minute thoughts or comments they wanted to add real quick?
Just on the dashboard, not just by county, but you can drill down by age, by income level, a lot of availability to really drill down in that data and study it for whatever the nonprofit's focus area is. A lot of good data on the dashboard, and we look forward to being able to use that and provide that as a resource to our community partners.
Absolutely. So once again, on behalf of all 4 of the women's funds, I want to thank the Basic Needs Giving Partnership, which is a collaboration between JJ Keller and the U.S. Venture, as well as the community foundations in Green Bay, Oshkosh, and the Fox Valley, as well as the Point Initiative, which is a U.S. Venture. They were hugely supportive of this idea from the beginning and helped us to make it happen. So hugely appreciative of that. In the coming months, you will see each of us also moving forth with community conversations to talk more in depth about potential solutions. We want to hear from you as the community on what we might do with this and areas that you feel that would be important. So I know each of us have started some conversations about what that's going to look like in each of our communities as well. So with that, we are going to wrap up this edition of our Project Table Talk. Thank you to our guests, Karen, and Julie, and of course, Erin again for co-facilitating. We'll see you all again at 1 o'clock on Thursday, July 22nd to discuss our phase 2 of the Fond du Lac Says No More initiative, engagement of men and boys in ending violence against women and children. We will be hosting Pete Snyder of Moraine Park Technical College, as well as Chris Ward from the local Dock Spiders baseball team here. So we will see you again soon. Thank you all.
Thank you for having us.